Recent high market demand for aesthetic and beauty treatments is driving many wellness spas and health clinics to consider adding procedures like facial filler injections to their menu offerings. If you're considering this highly profitable vertical, you'll want some education on what filler injections are, the types out there, how the procedure works, and the risks before taking next steps. We'll cover these topics and more in today's video. Hi, I'm Jason Seitz, paramedic, nurse, and director of education. Welcome to Guardian MD. Before we get started, please take a moment to like and subscribe. Your feedback is the most important way you can help ensure we keep this education free and accessible to everyone. There are two major types of facial injectables: facial fillers and neurotoxins. While both are injected into the face and used for aesthetic purposes, they are quite different treatments. For more information about neurotoxins like Botox, check out our Botox video in this same series. The two differ in that while Botox and other neurotoxins paralyze muscles to prevent wrinkle formation, facial fillers will introduce a substance to fill in the wrinkled area or add volume to an area. Small injections are made into desired areas to fill or plump the area up. So what substance is injected? That depends largely on the filler. Originally, collagen injections were the most prevalent fillers. Collagen is a protein that plays a large role in the structure and growth of our skin, blood vessels, nerves, and hair follicles. The dermal layer of the skin is mostly made up of collagen, and this important protein allows our skin to have a sturdy but elastic structure. As we age, stress our skin, and expose it to the environment, that collagen support can weaken and cause our skin to lose its elasticity, moisture, and our youthful appearance. What collagen injections do is simply introduce more collagen to areas of poor elasticity where the skin has thinned, producing aesthetic results. Just like your natural collagen, over time the injection can break down, and you or your patient might consider readministration. However, many brands of collagen can last upwards of a year. Because of these semi-permanent results, alternative dermal fillers that have become wildly popular contain something called hyaluronic acid. Hyaluronic acid fillers are quickly becoming a favorite facial filler with providers and patients alike because of their relatively safe and less permanent results. Popular examples include Juvederm, and Restylane. What's unique about hyaluronic acid is that after injection, if the patient is displeased with the result, effects can be reversed by injection with hyaluronidase. Hyaluronidase is an enzyme that will dissolve the filler through a catalytic reaction with the acid. Now, instead of waiting long periods of time for your body to wear down a collagen injection, fast results and treatment tweaks can be performed. Hyaluronic acid is found naturally in the body as a lubricant in the joints, eyes, and skin. It grants skin elasticity by lubricating the space between collagen and elastin fibers and attracts water to hydrate the area. This allows the skin to volumize and smooth, eliminating wrinkles and thinning. There are several other facial filler options available, including fat injections, polylactic acid, calcium, and polymethyl methacrylate beads. All of these methods are more permanent than hyaluronic acid. As with any treatment, it's important that the patient weigh the benefits and risks involved before moving forward. Filler choice can depend on permanence, the location of injection, the thickness of the product, and patient and provider experience or preference. Whatever filler you choose, be sure to obtain the proper education on injection technique and ensure that you or your provider are operating under compliant physician supervision with a medical director or physician collaborator. Medical directors and physician collaborators are required for non-physician run medical practices to operate. If you or your clinic need help partnering with a medical director, that's what we at Guardian do. Check out guardianmd.com to find out how we can pair you with a supportive, competent, and compassionate physician that can assist your practice in not just staying compliant and legal, but also promoting your business growth with tons of resources and education. While the use of facial fillers is relatively safe, like any medical procedure, it's not without risks. Some side effects or complications of facial filler injections include allergic reactions, bleeding and bruising at injection sites, scarring, infection, bumps, pimples, and rash, asymmetrical results, and intravascular injection. The most common injection areas include below the eyes, the temporals, the top of the nose, the cheeks, the nasolabial fold, the lips, marionette lines on either side of the lips, the jawline, and the tops of the hands. Prior to the procedure, providers and patients should communicate about the risks, desired results, and discuss health history and allergies that may preclude the patient from participation in the procedure. Patients should be allowed time to express concerns, ask questions, and receive education. Before any procedure is conducted, informed consent should be signed, stating that the patient is aware of the risks and has granted the provider permission to administer the treatment. The procedure itself is fairly simple. The skin should be prepped with an alcohol swab or antiseptic wipe prior to injection to ensure clean aseptic technique. Injections are made with a 25 to 34 gauge needle, and typically 1 to 2 milliliters of filler will be injected into the desired area. Though, depending on your product, areas like below the eyes may take less, and areas like the jawline may require more. Providers should consult the product's instructions for dosing information and be familiar with the product before use. To avoid pain, lidocaine cream can be applied to the face beforehand, or some products are mixed with lidocaine to numb the area as it's injected into. You'll be able to see results instantly, as the product will take no time to take effect. As you can see, facial fillers are a safe, effective, and profitable procedure for many health and wellness clinics to add to their repertoire. If you're ready to take the next steps, contact Guardian MD to make sure you're doing it compliantly, legally, and safely, with friendly medical directors and educational resources to assist in your business growth. And don't forget to like, subscribe, and follow. Thanks for watching. We'll see you next time.